Okay, and we're live.
Thanks, Martin. Good evening, everybody. My name's Lynne Doherty and I'm leader at West Berkshire Council. We're going to do a COVID update on the situation here in West Berkshire for you this evening. So I'm joined by Matt Pearce, who is the head of our public health team. We wanted to give the opportunity for residents to ask questions about what is happening with regards to COVID here in West Berkshire. We've done one of these before, so what we will do is we will go through and answer pre-submitted questions. But for those that are watching live, please feel free to enter any questions that you have in the chat and we will take those on board as well. So we've got lots of questions because I think there's been an awful lot of interest in what's happening here in West Berkshire over the recent week, particularly because on Thursday we heard the announcement from the Secretary of State that we in West Berkshire, along with the rest of Berkshire, are moving to tier level 3 on Saturday. So in the early hours of Saturday morning, we become tier level 3, which is the very high alert for West Berkshire. And that means a number of changes for our residents. And we thought this was a good opportunity to take you through those changes. I think there's two questions that is on everybody's mind. Why have we moved from tier 2 to tier 3? And what has happened with the numbers of cases of COVID in West Berkshire, which have suddenly shot up over recent weeks, week to 10 days? I'm going to let Matt talk about the second point, but I thought it was just interesting to talk about the move from tier 2 to tier 3 first of all, because had we looked at this situation at the start of December, you would have seen that West Berkshire had very, very low numbers of COVID cases. In fact, we had a downward trend with regards to the areas that they look at when it comes to deciding which tier level we'd been in. And we were looking at things like our case rates in all age groups, which were down at about 52 per 100,000. We look at case rates in the over 60s. We look at things such as our positivity rate, which is the number of positive cases detected as a percentage of all those tests taken. And we look at the pressure on our local hospitals. Had we had this conversation at the start of December, that was, as I said, heading downwards. However, unfortunately, we have seen a very quick rise in cases over a very short period of time in the last week to 10 days. The sharpness of this rise and the number of outbreaks we're dealing with locally has sadly and inevitably meant that we have moved to tier 3. From the 5th of November, we saw a case per 100,000 rise from 58% to the 11th of November, 184%. This was an increase of 172%, which is amongst the largest across the southeast. And for me, it just shows how quickly things can change. The speed has taken us all by surprise to a certain extent. And I know many of you will be disappointed that we are now in tier 3 because of what that will mean to you and our businesses here in West Berkshire. And we'll talk a little bit more about exactly what being in tier 3 means, but I thought this was a good opportunity at this point to hand over to Matt to talk about there's a combination of different factors that we see behind this sudden increase in cases, and I thought I'd hand over to Matt to let you to take you through those cases. So Matt, do you want to talk about our sudden rise in the number of cases here in West Berkshire?
Yeah, sure. Thanks, Lynn, and yeah, evening everybody. So unfortunately, there's no single one explanation really in terms of why the rates have increased suddenly. Clearly, we were in a strong position at the beginning of December, as Lynn said, in terms of 50 per 100,000, and that's escalated now to about 178. What we do know from the data is that there's just been a general community rise in transmission across mostly all ages. We have seen slightly more of a significant age in younger people, but generally across the whole of the age groups, we've seen a rise. And the other thing we've seen is a rise in the number of outbreaks as well. So whether that's in care homes, in schools, and in outbreaks. And ultimately, we know with this virus, it moves when people are in close proximity. So it could be that people might be mixing more. But we also know that one of the reasons the virus spreads is because people obviously get closer together. Some of the work we've been looking at in terms of why the virus might transmit more so in West Berkshire is in terms of household transmission. So not just in West Berkshire, but in other parts of the country as well. We know that about 40% of some of our transmission is within households. Obviously, people mix more closely in that situation, and as I said, schools is playing a part in that, but it's general community transmission. Now, the other thing we know is about a third of people that have COVID are asymptomatic, and that also why it's so hard for us to understand exactly where community transmission is taking place. So unfortunately, there's no simple answer. It could be behavioural, cultural, environmental. People might be behaving differently because the vaccine is available now. It's clearly getting closer to Christmas, and it could be fatigue as well. I think residents have done so well in terms of adhering to government guidance, and it just gets more challenging as time goes on. But inevitably, we have to keep this good work going. We can bring rates down. We've seen that in places such as Liverpool, in Bristol. We know they've come down from tier 3 to tier 2. So it's going to be critically important over the next weeks, particularly with the new guidance out around Christmas bubbles and into January, that we continue to play our parts. Unfortunately, no straight answer, as I say. We do look at the data daily, and what that is telling us. We also ask, to our test and trace, ask people who test positive to think about where they were 7 days before they had symptoms or when they had a test. And that gives us a bit of an idea then in terms of where they might have been when they got infected. And some of the answers we're getting for that in terms of common themes, again, is households, in terms of retail, out and about, schools and workplaces. So again, just iterates that point that people tend to obviously get the virus when they're mixing with others.
Okay, thanks, Matt. And I think what is on everybody's mind is the difference between being in tier 2 and being in tier 3, and what does that actually mean to how we will conduct our lives over the next few weeks. And I thought it was just worthwhile reiterating a few of the key points, because a lot of what is already in place for tier 2 remains. But I think the key points that I would like to just sort of reiterate to residents and ask them all to follow the guidance on is that you can now only see family and friends that you do not live with in certain outdoor places, public outdoor places such as parks and playgrounds, beaches, not that we're close to the beach, but those sort of public areas. You can no longer meet up in one another's gardens. So that's a key change. You should also avoid travelling outside of your area other than when absolutely necessary. And unfortunately for our businesses, because I know how difficult they've found the last few months and how much they've prepared to be COVID compliant and how hard they've worked, it does mean that our bars, pubs, cafes and restaurants must now close, with the exception of sales by takeaway, drive-through or delivery. And certainly I can talk about a little bit more later about the support that we, West Berkshire Council, are putting in place to try to help those during that difficult period. There is still the opportunity, shops and gyms and personal care services can stay open. Entertainment venues such as cinemas, theatres and indoor play centres, however, must close. So there is a lot of guidance available on our website, and I would urge every resident to take the opportunity to read those differences. And we here at the council will make sure that we continually push out to you what information we can, so that you're informed in how we should be acting over the next few weeks. The other thing that before we go on to everything else, I just wanted to talk to you a little bit about, because we've had a lot of questions coming in about schools, and I'm very conscious that our schools across West Berkshire are either on an inset day or have gone to online learning today. And I think it's just an opportunity for me to personally thank all of those teaching staff, the head teachers and all the support staff that have been working so very hard to keep our schools open. It has been a priority, and if anything were to stay open throughout this, I do believe that it should be our schools, because I do have concerns about the long-term impact on our children's education and well-being had they not been open. So I'd just like to take this opportunity to thank all of those hard-working teachers that have been involved in that effort, and our head teachers. There's been a lot of legislation talked about coming forward that going into the new year, there'll be a staggered return to schools, and you'll hear more about that over the coming weeks. And there'll also be the opportunity for testing within the schools using the lateral flow test to enable teachers and children to be tested on a regular basis, and you'll be hearing a lot from us over that period of time. It was only announced yesterday, so there is an awful lot of work to do between now and the 4th of January, when I know pupils are due to start returning. So just a really heartfelt thank you to those that have been involved in that, because people ask, should we have kept schools open? And I certainly believe that we should, because I think that the long-term impact on our children otherwise could have been far more detrimental. So just a big thank you from me. Matt, we're going to go over some of the pre-submitted questions now. One of the first ones we've had is about the mixed messaging, so telling everyone to go out shopping, and how we've enabled free car parking over the late night shopping, and how we've enabled shops to extend hours, but then we're warning people about the rising cases, and is this actually mixed messaging? So I don't know if you could say a little bit about that.
Yeah, sure. So I think it's just a balance of risk in terms of what individuals do. Clearly, what we want to do in West Berkshire is to keep the economy going, because we know that that has a fundamental impact on our health and well-being as a whole. But we also have to balance that risk in terms of individuals when we go out and see other people. I guess the key things people need to remember, which I've kind of referred to, and who have some simple ways to remember this. So 3 things to think about when trying to avoid transmission is close contact. It's the 3 C's: close contact, confined spaces, and crowd, as well as the amount of time you actually spend with someone. And I've already said to you, in terms of the home transmission is really important, and that's where we're seeing 40% potentially of transmission is within a home. So we know retail might be important, but sometimes that might just be coincidental, that people are saying 7 days earlier they were at a supermarket, for example, because that's what a lot of us do. So there's a real fine balance in terms of how we undertake our own kind of risk, but also recognizing that we still need to go out and shop and get food as required, and keep that economy going. That is really important.
Okay, thanks, Matt. And I guess that would explain, we've had a question about why we're allowed to shop but we can't meet inside the people's houses. So that would also be addressed by those 3 C's, I'm getting, of close contact, confined space, and well, not crowds in somebody's house, but that sort of ability to transmit that you've just talked about. The next question I'm going to come to, a lot of these are for Matt, and I make no apology for that, because he is the professional as far as this is concerned. So a lot of these aren't all our cases locally in children and young people, so there's no threat to hospitals. So there's a question about it being just with our children and young people.
Sorry, what was that question then?
Aren't all of our cases locally in children and young people, so there's no threats to our hospital?
No, I mean, as Lynn mentioned earlier, one of the indicators we look at is the rates per 100,000 of 60 plus, because and that's actually one of the indicators that government use to see whether you are moved up to a tier 3. So as our rates have been going across all ages, and also for those over the age of 60, that is an area of concern for us. Because we know that obviously those people who are older are most likely to suffer most. So it's not necessarily all younger people. It has been at some parts of the pandemic where rates were higher within specific age groups. But as I said at the beginning, we're now seeing rates rise across all age groups. And we have to remember that if rates are, even if they're increasing in younger people, they will inevitably go on to infect older people. It's just a matter of time. So I think sometimes we just need to be wary in terms of just saying that rates increasing in young people is okay, because as I said, it can easily move across all ages, particularly with intergenerational households and things like that, through household transmission.
Okay, thanks, Matt. And then probably building on that is, isn't it normal that people get ill at this time of year? Just normal respiratory issues?
It is normal that people get ill at this time of year, which I think is why we're probably more worried now than ever, because clearly a rise in rates in COVID-19 now, at a time when hospitals will already be close to their maximum capacity, is when we're worried about the NHS. So it is absolutely normal, and why we all have to take extra special care over Christmas, whether it's COVID or not, in terms of good hand hygiene. So yes, we just need to keep on top of it, and that's why I think the next couple of months are going to be really, really important going forward.
Okay, thanks, Matt. I'll take the next one. It will give you a breather. So we've had a question in that says, what is being done to encourage the police to actively enforce and advise the public to stick to the rules? We actually are in very close contact, it won't surprise you, with the police, and are joined in our regular weekly meetings by them. And I actually asked for an update for everybody today. So the police are very much responding to calls that are related to the breaches of COVID-19 legislation. It's not possible for them to attend every single call that they receive, but they prioritise those that appear to pose the most impact on health and those that relate to repeat locations. These calls are dealt with at the time and they're reviewed every 24 hours to identify repeats and those that require further investigation. They have also got some resource entirely dedicated to COVID patrols every day, and they cover the whole of West Berkshire. So they're very much working around, and they talk to, when we were talking with the police, they talk about our 4 E's principle, which is very much trying to engage and explain and encourage those that they find who are in breach of some of the guidance. So they're very much trying to work with people here, and most people, thankfully, in West Berkshire do change their behaviour. However, where they have to follow the 4 E, which is enforce, they do issue tickets where necessary and proportionate. I think it's also worthwhile saying that they're working very closely and doing a lot of joint work with our own public protection partnership. And this is about a joint approach where they're all going into our various pubs, restaurants and businesses to make sure that we're working collaboratively to make sure we're helping and supporting those businesses to be COVID compliant. So I hope that answers some of the question about police, but I think it's also keen to make sure that there's guidance and there's legislation. They can enforce legislation, but the guidance they can encourage people to be following. They're not actually there to say you must social distance and spend time sort of doing that. It's very much around the legislation that they can enforce. So I thought I would take that particular question for you, Matt. Then the next question we've had is the rise in cases, Matt. Could it be because crowds are back at football and other sports, and has this increase coincided with the relaxation of the rules?
I've not seen any evidence to suggest that, if I'm honest. I still think the risk is lower in terms of outdoor events, just because there's more ventilation. So I've not seen any evidence to suggest that might be the reason.
Okay, thanks, Matt. There's another one here, and actually I think it's on, we've almost answered it, but perhaps you could say a little bit more about lateral flow tests, Matt, because there's the question come in that health workers are being tested, but teachers who have been working throughout the year teaching key worker children have not been offered these tests. So I know going forward there's a change in that with the lateral flow test. Do you want to say something about that?
Yeah, of course. So yes, there's lots of work going on in the background around lateral flow testing. And for those that aren't familiar with lateral flow testing, it's a very quick device that can confirm whether somebody has COVID or not, a bit like a pregnancy test, if you like. And there's several different work strands going on at the moment. So announced recently was the testing in schools. So from January, schools have the opportunity to use lateral flow devices to test their staff weekly. So that I think is good news, because again, that could potentially identify people who are asymptomatic. Another work strand to that is that they're also looking to test pupils on return to school, particularly years 11 and 13 in January. And then schools will also be looking to use testing on contacts, so children who are contacts of positive cases, so they can actually maintain in school rather than having to self-isolate as any other contact would do. But they would have to be doing that for testing daily for 7 days in order for them to continue at school. But they could choose to self-isolate if needed. We're also exploring other types of lateral flow testing in care homes as well, how we can support care home visiting. And also, because now we're in tier 3, there are other opportunities for the local authorities to look at what other type of lateral flow testing could be used, for example, if there are high areas of incidence. So if we do identify wards or a town where we think that actually there's high levels of transmission, we could look to do that. Clearly, all of this requires a big and huge logistical operation, and things are moving at scale and at pace. And that's what we're thinking about as a local authority in terms of how we could do this, how we could support schools and so forth. But that's very much something on our agenda over the next few weeks.
Okay, thanks, Matt. I'll take the next one. It's from Mr. Lee. He's asked, may I ask what you and the council will do to inspire local community behaviour that could enable West Berkshire to return to tier 2 or even aspire to tier 1? Thank you for that question, Mr. Lee. We've been doing an awful lot of communication, and communication has been really key with our whole response to COVID, and even doing sessions like this. I think this is my 4th Facebook Live session. We're trying to use every different social media channel, every different press outlet that we have. So we're working closely with our newspapers. We're trying to make sure that we get the word out there to make sure that people are able to respond and know how to behave correctly at this time. So really trying to encourage people to do that and making sure everybody is aware of how they should be acting to suppress the virus. And one of the things that's very obvious to me is during the national restriction measures, our numbers did come down dramatically. So we show that we can suppress the virus. We need to encourage people to make sure they continue to do that. And we really ask people to think about their social interactions and what they can do to make sure they're safe social interactions. So the whole continuous throughout this, as we've been talking about, make sure you wash your hands, use your face mask and keep your 2-metre social distance. And we sent leaflets out to every single resident in West Berkshire's home to make sure that they have that. We've also done things like street posters, and we work with our parish councils to make sure the message is out there. So we're very much hoping that we can continue to get that message across. And as far as inspiring, I think we only need to look at the impact that this is having on each and every one of us to realise that keeping our tier level low is where we would want to be for the sake of not only our businesses, but for our own mental health and for our own family situations as well. So we're doing an awful lot at that moment to try to make sure everybody gets that message and is clear about what they need to do. We've got another one come in, which I'll give to you, Matt, which is, given the numbers we are seeing in West Berkshire, it is hard to argue that we don't need action to reduce infection spread, and particularly among older people. What I find extremely frustrating is that after all this time with test and trace and the local version and the local intelligence gathered about COVID, there is a distinct lack of explanation from West Berkshire or anyone about how we went from a very low infection area, even with T2, to extraordinary growth numbers. So I know you've said a little bit more about that. I think there's just a frustration around that. And I think that's very much around the complexity of the virus we're dealing with. But I'll hand back to you around that frustration around the knowledge behind the numbers and the data.
Yeah, no, and it's a frustration I share because I've kind of already explained that it's not easy. It could be down to behavioural, social, a whole different range of reasons, and actually all the other areas across the country, neighbouring local authorities, even in the world, are still struggling to pinpoint how and why the infection rates vary so much and increase at certain times. As I said before, we know there's a lot of asymptomatic transmission, which is why testing using lateral flow devices might be really beneficial to help break that chain. I'm often involved in a lot of IMTs, we call them incident management teams, where we're actually meeting to respond to a local outbreak, whether it's a care home, whether it's a school, whether it's a workplace. And this is a multi-agency meeting. It involves Public Health England, Public Health, and others. And even when we're talking, we don't always necessarily find the links in terms of why something got into a care home or why something got into a workplace. Sometimes we do, sometimes we don't. And it's just the nature of the virus. It's really difficult sometimes to identify kind of where that transmission has taken place. I will make the point though, we do have our Berkshire Public Health website. I think we're quite good now in terms of showing and being transparent about all the data we get. I also saw a question in the group chat, Lynn, so I picked that one up around do we show data on local areas? And that's something we do show now. So if you go onto the Berkshire Public Health website, you will find rates per local authority, per MSOA, which is kind of a ward level data. So we do see that, but as I said before, we're not seeing any significant rises in any of our neighbouring areas. We are seeing maybe slight increases in the last few weeks in terms of the urban parts of the district, and again that generally reflects kind of national trends in terms of where people are just close proximity.
Okay, thanks, Matt. Mr. Davis has asked about why pubs are having to close when they've got they're demonstrably safer to visit than some of our high streets or supermarkets, where nobody's ensuring social distancing or face mask rules are complied with. So there's a little bit of frustration there about the hospitality industry and the impact on it, versus the ability to keep the high street and the supermarkets open. I don't know if you could say a little bit about the difference there, Matt.
Yeah, that's a really good question. I mean, a lot of this is derived by the government in terms of their tiering, and obviously their evidence is informed by what SAGE, which is the advisory group, inform the government. So I suspect there's been evidence that there has potentially been increased transmission rates in some of those settings. People are more likely to be relaxed, particularly if alcohol is involved. Again, people walking down the high street and walking past one another is less of a risky exercise to do, and we know that's just passing somebody in the street. You're less likely to pick up COVID than obviously being inside a pub or hospitality. So we're very much guided by natural evidence and what SAGE advised the government on that, and that's outlined in the tiers.
Thanks, Matt. We've had a question in about travel during this period. So if you're living in West Berkshire, but you need to go for whatever reason, because this particular person's asked because they've got their gym in Maidenhead where they work, does the rule around restriction travel in your area mean the place you live or your county? Can they still drive to their gym?
So, I mean, I think it's really important that everyone does have a look on the gov.uk website, because there is a tier 3 very high level alert web page, and that does outline all the guidance that people need to look at in terms of how they comply. I recognise that actually the travelling is a bit of a complex one, and that's something that I've asked my colleagues to actually develop a frequently asked questions sheet on, which we'll upload onto our website next week. What we know is that, if you're traveling into or out of a tier 3, you should really try and avoid it at all costs. However, there are exceptions to that. So for this particular individual, I think they said they worked in a gym. So for work purposes, you can actually travel outside to, to another area, as you can if it's for education or voluntary sector or caring responsibilities or moving home. There's a few different exceptions for why people can and can't move out of the area. The other one that I have been asked as well is about food shopping, particularly those people that live on on the borders of the district, and whether they can cross a border into a tier 2, whether it's for Oxfordshire, to get food and supplies. There isn't any specific guidance on that. My view would be that would be seen as essential, and that would be fine. But clearly, the most important thing is to reduce the number of travelling that you do as much as you can.
And we've now put the link up on the Facebook chat page as well. So thank you for doing that. Questions coming in, quite a lot of questions coming in. So first of all, will there be mass testing like in other tier areas? So in other tier areas, particularly where there's tier 3, will there be any mass testing, Matt?
I'll answer that partly. I'm not sure we will see what happened in Liverpool. Liverpool had about 2,000 army to support them, and I'm not sure that level of resources is available for all the tier 3 areas. What tier 3 do get is some military support. So as I mentioned before, we want to do very targeted testing. We think that's the most beneficial way of doing testing. So if we feel that there's specific cohorts of individuals or population groups that are more susceptible, or where we think there might be more asymptomatic transmission going on, then we will do that level of targeted testing. As I said before, if we do find there are parts of the district, and as I said, there's not really anything standing out at the moment, so where we felt that there was a particular ward where there's high levels of transmission, then we could potentially look at deploying a mobile testing unit and actually test. So that's kind of the things we're thinking through at this very moment in time. As I said, they are quite big logistical operations, but we're working through those.
Okay, Matt, I'm going to go to the live questions coming in. We've still got more pre-submitted, but I think because we're half an hour in and we're halfway through, I'm conscious I want to take the people that are on live, their questions, as we have the opportunity to do so, and then we can, if we've got time, come back to the pre-submitted. But what I would say to everybody is we've got a list of all of these questions, and we're going to put together, as Matt's already said, an FAQ which will go on the website, because if you're asking it, lots of people are asking it, so we'll make sure we do that. So I'm going to go to the bottom and work my way back up. So I've got one here that, Lynn, do we have any more information about COVID marshals for West Berkshire? Funnily enough, I was having this conversation today because at this moment in time, we took the decision to work with our public protection team, public Protection Partnership, and actually work directly with businesses and go in and be able to give guidance and advice. And they have been going across West Berkshire, and I've seen the reports on a weekly basis, visiting premises, checking them, and very much doing the role that COVID marshals are doing. We are a very rural area, and we've only got a couple of urban areas which sort of have a higher density of population. So we had the conversation about, was it worthwhile having somebody walking up and down in a high-vis jacket versus actually somebody, a team of people going across to all the different areas. And we took the decision that we would use our team to actually go across the areas and give that guidance and advice and go into all those different settings. Now, we will obviously keep reviewing that. With going into tier 3, I think at the moment that is still the right way to go, because obviously it's much more clearer cut and businesses shouldn't be open, but it is something that we'll keep under review and keep having discussions on. So I'll just give you that update on that. Question for you, Matt, is that somebody really likes your Berkshire Public Health dashboard, and please, it's a really useful tool, and we've tried to be really transparent about everything, but they don't understand why all the data has a 6-day delay. Why is the delay so big?
That's a good question. We've had that a few times. It's basically down to making sure the data is validated and accurate. So we could post data earlier, but it often gets refined. So sometimes there could be double counting, there could be duplicates in the data. So it's really about making sure that data is right before we publish it. So that's why there's a delay. And you'll see that in the gov.uk website as well. There's always a few days lag behind it. But that is important generally in terms of, particularly around death data, that's always a delay in that. But unfortunately, it's just to make sure it's right, rather than we put data out and then change it again. So that's the reasons for that.
Thanks, Matt. And there's a number of questions that have come in around the rollout of the vaccine, and what will that look like? When is the vaccine delivery to begin in order to protect a large number of vulnerable people? When will it be rolled out to the wider community? So can you give us an update on what's happening to the vaccine, please? I know this is very NHS driven, but if you could just give us an overview.
Yeah, sure. So yeah, absolutely, it is being coordinated by our colleagues in the NHS, but we're working very closely with them. And obviously, I know everyone's really keen to get a vaccination, and that's a key weapon, if you like, in terms of our battle against COVID-19. So at the moment, the NHS is following the guidance by the government in terms of focusing on those priority groups that would benefit the most. So at that moment in time, the effort is focusing on over 80s, because we know that they're the most vulnerable, and then also health and social care staff, particularly workers in our care homes and care home residents. The challenge we've got is the supply of the vaccine will take some time to go through, and then the logistical operations, again, in terms of keeping that vaccine at -70, is hindering that ability to be deployed as quickly as we like. We know the NHS is working very closely with primary care practices, and there's several different waves of that deployment of that vaccine. So it will take a little bit of time, and I'm hoping in January that there'll be a much improved supply of that vaccine through the system. But as I say, I know the government are working quite hard, and again, so I use that word logistics quite a lot in this session, but it's another big effort, to vaccinate huge numbers within the population. So it's going to take some time, but I know that people are working flat out behind the scenes to make it happen.
Okay, thanks, Matt. And then I've got a question here around, will you still be able to go for a walk with a friend? Actually, do you want me to give you a break, Matt? Because I can answer that. You can still meet up with other people so long as it's in a public place, so a public park. So that going ability to meet up still remains, no more than larger groups of 6, but it has to be in a public park. It can't be in somebody's out back garden. So the walk would still certainly be possible as far as I'm concerned with regards to that one. Would you agree, Matt?
Yeah, I think so. I don't know if I saw in that question though. Obviously, you don't want to go into another tier to walk, so don't go to a tier 2 to walk. That's not seen as an essential journey. So that would be my only caution on that. But absolutely, I think one of the things that we learned quite early on in this pandemic is getting outdoors, physical activity. It's good for your physical health, your mental health, and that's really important. So we know these times are challenging for our mental health and well-being. So yeah, I certainly wouldn't want to put people off from doing that.
Okay, thanks, Matt. We've got a question here about when will the tier assignments be reviewed. The reviews are happening every 2 weeks, so I make that the 30th of December before the next review. So the next review will be due on the 30th of December, where again they will look at the criteria that I spoke about at the start of the call, and they take all of that into account when they're looking at that, and that's when we'll get the next review. There's a question here about, are you also backward contact tracing to find sources of cases? So this is really about our local contact tracing, Matt.
No, this is no, no. Sorry, this is actually, I did talk a little bit about it. So backward contact tracing is when, no, that's okay. Is when somebody tests positive, the National Test and Trace Service would ask them where they've been 7 days before they had symptoms or a test. And the reason they ask that question is then to find out where they might have been when they caught the virus. So the test and trace do that. And as I alluded to earlier, we are getting some, they're called common exposure reports, the terminology we use for this. And we do get common exposure reports in terms of some potential settings where, you know, several people have identified where they might have been 7 days prior to them getting a test or having symptoms. So we do review that data. As I said before, often there are some retail settings that we see, but then that could be just because people frequently go to retail settings. So you'll often get many people saying they've been in the retail setting 7 days before. Sometimes we get schools and workplaces as well. But one other point I wanted to make today is one of the challenges that we have in monitoring the data is that if people do test positive, it's really important to tell us where they work when they fill in the National Test and Trace form, because that will help us establish any patterns in terms of where there might be problems. And at the moment, that data, it isn't there. Not many people disclose that information, and I could possibly understand why, but that's so important for us to really understand in terms of the surveillance, you know, monitoring that and seeing where there might be problems that we might need to react to, whether that's around enforcement, whether it's around testing, and so forth.
Okay, thanks, Matt. Then we've talked about the statistics relating to where cases are coming from. So there's a question, do we have statistics relating where cases have come from? And you've explained that. The follow-on is, do we really have strong issues with rule breaking in the community, or is transmission occurring in places that should be COVID secure, i.e. schools, care homes, hospitals? I think you have touched on that, but perhaps just explicit to that one.
Yeah, I mean, you know, we're inevitably finding somewhere that might be COVID secure, and there will be cases, and we're seeing breaches, whether it's in the care home, and sometimes that's through human errors, behaviour, you know, and obviously we try our utmost to support our local settings. Care homes, you know, had a really, really difficult time, and they have some really robust processes in place now. But in schools, for example, all it takes is one household transmission from a parent to an adult, from a parent to a child. That child has a bubble, and they will be, you know, they'll be closely in proximity with those children in that class, so there will be spread. I mean, there are some key things we're finding and learning, whether it's workplaces and other outbreaks. What things are that car sharing is a big one we're finding, where people might car share to work needlessly, and that's, you know, then they infect one another. Another one in workplaces in particular is around staff rooms and people congregating. They let their defences down, so when they're actually at work as such, they're on the ball. But you know, smoking is another one, outdoors and congregating. So we often hear lots of different feedback in terms of where we think there might be issues, and what we try and do is then put in place the measures to change that, but also share good practice with other areas as well. So I think settings are trying really hard, you know, schools are trying really hard, care homes are trying really hard, workplaces are trying, but you know, sometimes things don't always go to plan, and then there are problems. What we try and do is get in there quickly, help that setting out, and hopefully put in place measures to prevent it in the future.
Okay, thanks, Matt. Sorry, Matt, when you were talking about vaccines, did you talk about timescales for rollout?
No, I mean, I don't.
There's a direct question around the timescale for vaccine rollout, and I know that there's a set process for who will get it, but I don't think any timescale's been published nationally even on this, has it?
Not that I'm aware of. It's all down to the supply of the vaccine. Clearly, we're waiting on the Oxford Zeneca vaccine, which is currently with regulators at the moment. So that's one that's developed in Oxford, which only has to be stored at fridge temperature. And I know that the government have potentially procured, I think there's something in the region of 30 million doses. So if that vaccine is approved, and we don't know when that might be, if I'm honest, then I'd imagine the speed and rollout of vaccinations would increase quite rapidly. But again, you need the staff to do it. So yeah, unfortunately, I've not seen any specific deadlines. I know that kind of, I mean, the other thing we need to think about is people need to have 2 doses of the vaccination for it to be, fully effective, and 21 days apart. So even if we've done the first doses in some individuals, they need to come back again. And I think by March, April, the kind of timescales I were hearing in terms of the 80 plus care home residents, that they should hopefully be done at that point.
Okay, thanks, Matt. And I think that's we answered. You answered the question. I had a different question. So I had a question about walking with a friend, but you answered the question about the Wiltshire border. And a child goes to school in Wiltshire, but they live just inside West Berkshire. So are they classed? Are they able to go from tier 2 to 3? But I see that we know that education is an exemption for travel into tier 3 areas. So it's still okay for your daughter to travel from to and from school in a tier 2 area. It is exempt.
Yes, yep, that's correct.
Okay, thank you. And I think that's all the questions we've got on the live chat. So I'm just going back up to cover off where we were. So because I'll keep an eye on the live chat for us. You've talked about the vaccine because we've got a particular incident there of somebody living in an area and wanting to know when it would come to them. Patient transfer from tier 3 to tier 3 home. Can you clarify what needs to be done to achieve this, Matt?
Yeah, I'm not quite sure what that question's
No, I'm trying to think what
particularly
the tier 3 is.
asking, but I would have thought that would have been an exemption under medical need. So if somebody needs to transfer from tier 3 to tier 3, that's perfectly reasonable, even if you're going from tier 3 to tier 2. So if there's a medical need there, I would have thought that'd be okay. My advice would be to ask the particular setting in terms of that transfer, whether it's a hospital, and just seek some additional advice on that. And going back to my point on vaccines, actually, somebody asked around speed of rollout. I mean, my best advice would be to kind of, I know that primary care will be issuing letters to all those, once the vaccine is available for them to be invited in. So I was going to suggest contact primary care, but I don't think they'd thank me for that. So yeah, my advice would be to wait and to be informed. Sorry, I just digressed a bit there.
No, thanks for that. I think it's useful information for everyone to have. Okay, I've saved this question to last because I see the chat's drying up, and we won't keep going for the sake of keep going. I think we've covered an awful lot of ground, and as I say, there's going to be an FAQ put up on these questions. So I've saved this last question to last because I thought it was an appropriate one for us to end on. So it says, are Christmas bubbles a good idea? Should I see my elderly relatives? And I think you and I will probably both have a view on that. So do you want to start with that, Matt?
Yeah, I can do. And I think the government I think they've tried to communicate this week in terms of the Christmas bubble, what that means. Clearly, we are now in a difficult place in West Berkshire with our rates going up. We're now in tier 3. And I think what people need to do is just evaluate, the level of risk that they might potentially put them and others in as part of their plans for Christmas. I think we recognise Christmas is a difficult period. Well, not a difficult period, but it's going to be a difficult period for a lot of people. So they won't be meeting with all their friends and family. I think the key thing is that the numbers are there, but they're the maximum numbers. So a maximum of 3 households could mix over the 4-day, I think it's 4 or 5 day period. That's not each day either. So I've had lots of questions around, could you mix with 3 different households each day? No, it has to be the same 3 households, but that is a maximum limit. And I think what the government really, and what I would suggest as well, is actually just really think carefully in terms of who you are meeting up with, what is their level of vulnerability. But, I think I recognise that there is, the mental well-being aspect of that in people, social isolation and loneliness, that is important. But just think carefully about that. Are there a way you can meet outdoors? Could you do something online or remotely? So that would be my advice there. But again, I'm sure my colleagues could put up the advice online for that.
Okay, thanks, Matt. I think it's a really difficult decision, and I think each and every one of us will have to look very closely at what that decision should mean for your individual family. We all have different family circumstances, and I think Matt's very accurately weighed up. You need to be able to look at what that balance of risk is between your family makeup and whether you have vulnerable family and whether there is more of a risk of isolation or loneliness at this special time of the year. So I think it's got to be done on a case-by-case basis. We would want people to take sensible decisions. I think there's a few things, as Matt says, that we can do if you decide to meet up with family. You can reduce the length of time you actually meet up. You don't have to do the full length of time that you're able to mix up a meet up. I think there's also things that we can do, like extra cleaning before we have our visitors. So cleaning down those high touch areas, making sure that you have open windows. I know that's not ideal at this time of year because it's cold out there, but we do know that ventilation is key to letting the virus out. Reducing the amount of time you spend indoors. So, you know, getting out there, getting some exercise in those public parks would be a good thing to do. And then continuing to sort of social distance and understanding, you know, the reality of each and every family's situation is going to be different, and you need to be able to take those personal judgments for yourself. So making sure that's the case. And there's a couple of things I would add to that is, you know, there is help and support available. That we have got a COVID winter hardship grant. If people are struggling at this time of year and they're worried, that we've got our community support hub that is there. So please do feel free, and I'm sure we can put up the contact details for the community support hub, because that has very much been our enabler and our gateway to some of the community groups that have done such a fantastic job throughout the response. And we just want people to know, you know, if you're in difficulty and you need help, whether that be because of social isolation and you just need somebody to talk to and you need some support around that, or whether that be because you're financially struggling, please do get in touch. Don't feel you have to struggle alone, because it's a terrible time of year to be struggling on your own, and we appreciate that. And that's why I think it's so important that you have the opportunity, but you take and think very carefully about taking that opportunity. So I think that's probably a good place for us to be ending, Matt. I don't know if there's anything you'd like to add before I wrap up.
I don't think so, Lynn. There was one other question I did see, sorry, around the new strain or variant of the COVID virus and whether that could be a cause for the increase in infection rates. My understanding is we don't yet know in terms of what that new strain, in terms of how it might change transmission rate, infection rates and severity of diseases. So that could be an explanation, but the evidence just isn't quite there yet. So we will continue to review that. What the professionals are saying is they don't think it will actually affect vaccine efficacy. So they still think the vaccines will work even with this new variant of the COVID-19 virus. Sorry, Lynn.
Okay, no, thanks for that, Matt. If you're interested in hearing more about what's happening directly in West Berkshire, on 6 o'clock on Mondays, a fortnightly, so there's one this coming Monday, the 21st, we conduct our local outbreak engagement board, where again we review the figures. So the latest figures are there. Matt and I are both there, as are a number of different people, to look at what is going on here in West Berkshire and to have these types of conversations. That is all on YouTube, so I'd encourage everybody to watch those meetings to keep up to date. The other thing I'd encourage you to do is, I think the link to our newsletter bulletin has been put in. So every time, our comms team, as I said, have been working really hard. So when we have information about changes, if we have information about new tiers, if we have any information at all related to COVID, there is a bulletin that you can sign up to that gets that information direct into your email box. So I would encourage everybody to sign up for that, so that you can have the news as and when we have it, and can get it out to you as quickly as possible. What I would say, and I'll just wrap up here, is to wish everybody a safe and Merry Christmas. It's a special time of year. I appreciate it's a very worrying time of year for a lot of people, but please take care. Please continue to follow the guidance. And I think Matt and I probably can't stress that enough, because I think only by reducing those social interactions are we going to be able to reverse the trend that we're currently seeing here in West Berkshire. So I would urge everybody to do that and say thank you very much for joining us. And we will no doubt be seeing you shortly in the new year, when we'll probably be able to talk far more about vaccines and how we're getting on with the lateral flow testing. So thank you for joining us this evening, and good night.